patient had liposuction with me previously, and so after the liposuction on one side she noticed some bulging here next to the axilla, and so when I felt it I thought maybe I missed the spot when I do the lipo, which does happen. In that case I sometimes lipo that area again, but in her case I felt something there that seemed like it was a lipoma with a capsule, so I sent her to get an ultrasound. She got that ultrasound, which indeed showed this lipoma, so at the same time we will remove this lipoma, so then she can be flatter here on the side, and at the same time she's not going to have the lipoma. So whenever you want to remove something from the body, first you have to find it, and to find it you have to make an incision and expose it. So this is what I'm doing here. I made an incision in the skin and I am looking for this lipoma, but the challenge is it looks similar to the fat that's surrounding it, so you have to kind of feel for the capsule. And so here it is. If you see it, it's coming out, it's nice and round, and so it has a capsule, and I'm able to feel it with my fingers to identify exactly what I have to remove. So you have to separate it from everything else, and it's stuck to tissues that surround it, so you use this Bovie electric cautery to mobilize it, and once you feel like you can remove it, you give it a little pull and it comes out. Here we go. That's the lipoma. We send it to pathology to make sure it is what it is, and then you have to make sure there's no bleeding around, and you close the incision. You close the incision. As plastic surgeon, we try to close the incision in layers to give it the smallest possible scar. We try to hide the incision, and so here I'm putting in absorbable sutures to line up the two edges of the skin so they come together, and after it heals so that they're not really visible to the eye. But if you're having surgery, you always have scars, so if you look close enough, you'll always see the incision. And these sutures will dissolve. They're called monochrome sutures, and here it is. I finished the incision. It's a little puckered, which is supposed to be like that. It heals best when it's that shape, and so there we go. We made a little incision. We try to hide it in the axilla, and then we dissected down, found the lipoma, removed it, and closed the incision with absorbable stitches. So lipoma was about 7 centimeters. It was actually quite large, and so she should feel improved bulging over here. So this area should flatten out. So the surgery was a success, and then we'll see how she does in about a week.